Hello, everybody. I'm Dr. Mansi Sharma, and I'll be talking about debilitating quality of life with smoking and tobacco beyond cancer, comorbidities that we can avoid. So, as we know, India is a country with a population, and it's nearly the second largest producer and consumer of tobacco in the world. Nearly 27 crore people, that is 30% of the adult population in India, chews tobacco or smokes tobacco in some form or the other. An important point is that it's not just smoking in India, it's tobacco like 𝐓𝐻𝐂𝐂𝐊𝐒, zarda, tobacco chewing, BDs, gutkhas, hookahs, all these things which are also consumed all over the country. And this is associated with a lot of diseases, including a lot of cancers. Nearly 12 to 13 different cancers have been associated with tobacco exposure, from top to toe: the throat, the esophagus, the food pipe, the lungs, the kidney, the bladder, the intestines, cervical cancer. They're all associated with smoking, and of course the dreaded lung cancer, which the risk factor to get lung cancer increases by nearly 25% in smokers. But what I will be talking about it is not just cancer. It's that smoking is associated with a lot of other comorbidities which can decrease your quality of life. Again, starting from top to toe, it is associated with eye issues leading to cataracts, leading to irreversible age-related macular degenerations, which can lead to blindness later on. It can lead to dental issues, especially the smokeless tobacco, can lead to tooth fall, poor gum hygiene, and a lot of other issues. Of course, all forms of tobacco increase the risk of heart disease, that is coronary artery disease, as well as stroke, to the tune of nearly 2 to 4 times more than the normal risk in the normal population. It can lead to worsening of diabetes or cause diabetes. It can have severe effects on the lungs, cause an exacerbation of those patients who already have asthma, can lead to chronic obstructive lung disease, which is when the lungs really, because of the harmful effects of smoking, stop working very well, can lead to end-stage lung disease towards the very end of the spectrum. Because tobacco causes a lot of inflammation inside the body, it can be associated with a lot of inflammatory disorders. It can be associated with rheumatoid arthritis. For those people, especially the young people in the audience, you should be aware that smoking can lead to infertility issues in both males and females. It can lead to pregnancy issues. For ladies who smoke while they're pregnant, it can lead to adverse baby outcomes, fetal outcomes, can lead to premature deliveries, can lead to growth retardation, and later on in life, secondhand smoking can be, a cause of sudden infant death syndrome as well. For elderly people, it along with the other diseases, it can also lead to loss of bone health. So these people can land up with having more fractures, more bone issues later on in life. So, this is just a spectrum of all the different issues that we can face with smoking. This can also be related to a lot of developmental disorders. It can lead to a lot of mental issues, depression, people who abuse tobacco. And very important aspect of this is secondhand smoking. A lot of people, do tend to smoke around their family members, around their children, and it has been seen that it can lead to worse respiratory issues in children, lead to more infections, including ear infections, lung infections, and yes, again, developmental issues later on in life. What is also important is that all this eventually leads to worsening survival. You lose nearly a decade of your life if you smoke or consume tobacco. The world over, nearly 32 crore people less than 30 years die because of tobacco-related issues and health disorders. And in India, it's nearly to the tune of 13.5 lakh deaths per year. So it's a lot of burden, it's a lot of comorbidities, it's a lot of quality of life issues. And the end result is, again, not trying to scare anybody here, but the time to act is now. For everybody who's seeing this video today, hearing me speak, please go back home with a message that, even if you quit smoking now, these effects can reverse over a certain number of time. As it's like as small as if you quit smoking, within minutes your heart rate improves, your blood pressure improves, within weeks your exercise capacity improves, your risk of cardiovascular disease and stroke starts coming down, it normalizes, or even there's a sudden decrease. The risk of cancer comes down by nearly half in almost 5 years after you quit smoking. Of course, the risks associated with smoking are more when you start young, but the risks associated with quitting, the benefits of quitting are also more the earlier you quit. That is to say, those patients who already have developed diseases like, say, cancer, like heart disease, like stroke, even those patients, if they quit on diagnosis, that can also lead to better outcomes for them, lead to a better quality of life for them. So another thing is finances, because there's a lot of issues with all these financial issues, financial toxicity associated with the treatment of all these comorbidities. So that can also improve the quality of life of the entire family, can improve. Your friends, your people you work with, they all get less exposure to secondhand smoke, and this can all also lead to overall better outcome for everybody, including you and people around you. So again, I would like to end by saying that this is the best time for those people who are thinking of starting smoking or tobacco related products. Please do not. You will benefit a lot by not doing it. And for those people who've already started smoking, it's never too late to quit. So thank you. I hope this helps.